Good morning, everyone. Today I'm going to talk about my PhD topic, Complementary and Alternative Chinese Medicine in Pediatric Oncology. Since I started on the 1st November 2022, so this is my first progress report. I'm Nicole, and I'm currently studying at Semmelweis University. My supervisor is Miklos Garimi, and my SMS are Li Ximeng and Mark Hanadfree. My vision is improve the quality of life of pediatric oncology patients during and after treatment, and my mission is to confirm the efficacy of traditional Chinese medicine and promote the use of TCM complementary therapies. So this is my first topic, investigating the addition of complementary and alternative Chinese medicine among pediatric oncology patients treated with Western medicine therapies. It started on January 2023. Traditional Chinese medicine is based on a deep understanding of the laws and patterns of nature and the human body. It is a system of medicine that is inherently holistic, taking into account the physical, emotional, and spiritual aspects of health. TCM is becoming a popular complementary and alternative medicine approach in pediatric oncology. However, only a few meta-analyses have focused on clinical studies of the use of TCM in pediatric oncology. The short, medium, and long-term side effects of cancer therapy in childhood is still an unresolved and equally investigated area. The short side effects like hair loss and the medium side effects like delayed growth and organ or tissue damage, and the long-term side effects like chronic health problem and infertility. So our aim is to investigate the effect of additional TCM therapies in pediatric oncology. I'd like to introduce some TCM methods that are most commonly used in pediatric: acupuncture, manipulative therapy, cupping, and herbal medicine. I would like to show an example of the effectiveness of TCM via an article published in 2016. This is a retrospective cohort study of 292 pediatric leukemia patients. All patients received the Western medicine-based pediatric oncology treatment, and one of the groups had additional TCM therapies. I would like to highlight that, as you can see, the Kaplan-Meier curves show clinically and statistically significant in overall survival. Our clinical question is, does additional TCM therapies change the effects and the toxicities of Western medicine therapy in pediatric oncology patients? For the population, we use pediatric oncology patients, and for the intervention, we have Western medicine with additional TCM therapy. For the comparison, we use Western medicine therapy, and we are looking for the outcome like effectiveness, toxicities, and side effects. Our hypothesis is the additional TCM therapy can improve survival rates and reduce the side effects and toxicities of Western medicine therapy. Our clinical implication is inclusion of TCM in current guidelines. And I have found a previous meta-analysis, but it's very different from my topic, and I searched in Prospero. There are nothing similar to my topic. So after the systematic search, I searched both English databases and the Chinese databases. There are about 10,000 articles in English databases and more than 21,000 articles in Chinese databases. There are my search key. I have 3 domains: pediatric, oncology, and TCM. So this is my Chinese search key. They have the same domains: pediatric, oncology, and TCM. So after the duplicate removal, there are more than 20,000 articles. And I have already completed the duplicate removal. The Prospero is ongoing. So I plan to submit the article on August 2023. Thank you for your attention. I'd like to close my presentation with a quote: "Strive not to be success, but rather to be of value."
Congratulations on your presentation, Nicole. And my question would be that you mentioned 4 methods in your presentation, as TCM methods. And do you usually use them combined or choose one in case of patients?
Most of the time, they only choose one, and the herbal medicine is the most commonly used during the treatment or during the follow-up time.
So my question is, do you know what is the frequency of using TCM in Hungary among pediatric oncology therapy?
Well, actually, in Hungary, it's not very frequency. It used frequency, I think, only in China. But those years, the TCM therapy is becoming more and more popular in European.
I would like to ask that you have shown a Kaplan-Meier curve about the survival. Have you came across any articles during your preliminary searches that these traditional Chinese medicine methods can affect maybe the short-term side effects? Because we know that in pediatric oncology, the therapy itself has a lot of common side effects like nausea, vomiting, and have you found any evidence that maybe these TCM methods can better these side effects also?
Yes, there are some Chinese articles that show TCM therapy can affect the side effects of the pediatric oncology patients during the treatment. It can reduce the side effects.
Have you found any randomized controlled trials on this matter?
Yeah. Yes.
And if there's enough, will you make a subgroup analysis, or did you think about this?
Yes, during the literature review, I already found more than 5 run RCT trials, and there are some other cohort studies, so I think it has enough articles to do analysis. Thank you.
I mean, congratulations. I mean, you started later and then you already have a clear vision. Although, I mean, this is a big thing. I just have a technical question that how do you plan, your supervisors and others, I mean, that you touch actually a treasure, I mean, these kind of Chinese papers, which we normally don't have an access because we don't understand the language. But then when you do the selection, I mean, you need a partner. So how do you handle this? Because that's a very important part of the selection when you and the partner actually does it, so that actually decreases the bias of just making mistakes or overseeing that. So how is the plan?
Thank you. Actually, I have a co-investigator. He is also a Chinese student, so yeah, Ge Fu. We will do the Chinese selection part together. Thank you.
Thank you for your presentation. Could you speak a little bit about that previous meta-analysis? What was the result in that study?
They had the subgroups, and it showed that TCM therapies can, it shows the effectiveness of TCM therapies by measuring the overall survival and the risk of infections, something like that.
Thank you.
You showed data on the survival rate, on the effect of survival rate TCM in pediatric oncology, but do you plan to assess any other effects of TCM, like pain reduction or quality of life or those things? So not only survival rate?
Yes, it will be included in, I think, the cohort study. It shows through the from the side effects. The TCM therapies reduce the side effects so that it can improve the quality of life.